Good afternoon, everyone, and thank you very much for joining us today. My name is Emily Mooney, and I'm the project lead of the Community Knowledge Program at Wellesley Institute. Before we begin, we wish to acknowledge this land on which Wellesley Institute operates. For thousands of years, it has been the traditional land of the Huron-Wendat, the Seneca, and the Mississaugas of the Credit River. Today, this meeting place is still the home to many Indigenous people from across Turtle Island, and we are grateful to have the opportunity to live and work on this land. Welcome to our second community panel. The Community Knowledge Program aims to encourage collaborative research and knowledge sharing within the immigrant and refugee serving sector in the Greater Toronto Area. We work to fill existing gaps in how researchers, policymakers, and community agencies work together to conduct research and apply its findings to frontline work with newcomers. Last month, we brought together 4 panelists from different parts of the sector to tell us about their experiences and perspectives in research and knowledge mobilization. Today, we have 2 remarkable speakers who will explore how information and misinformation can spread in newcomer communities and how researchers, service providers, and community members can help make sure that reliable, evidence-based, up-to-date information on critical issues such as COVID-19 is shared in culturally sensitive and relevant ways. Unfortunately, one of our scheduled panelists, Nadia Kaidi, is unable to join us today, I'm sorry to say, and we hope to invite her to a future event. To learn about her work, you can visit her website, kaidi.ischool.utoronto.ca. Before we get to the speakers, I wanted to go through a few housekeeping notes. Please keep in mind that this webinar is being recorded. The video and transcript will be available on our website later this month. If you require subtitles, you can enable live transcription by clicking Live Transcript at the bottom of your screen and selecting Show Subtitle. Please note that the chat function is disabled for this event, but we encourage you to use the Q&A function at the bottom of your screen to participate. As soon as we finish the discussion, a short survey will appear on your screen in your browser. We would very much appreciate it if you could stay with us until the end to share your feedback, as we will use it to improve future programming. We're going to start with our panelists' presentations, and then we will come back together for questions afterwards. We have 2 amazing panelists that we will hear from today. First, we will hear from Brannavy Jeyasundaram. Brannavy is a writer, Bharatanatyam dancer, and the co-executive director of the Toronto Ward Museum. She is also the managing editor of a literary journal exploring global politics, Adi magazine. Her main interest lies in exploring movement traditions and memory formation through understanding histories of displacement. Her writing on cultural memory can be found in The Local, Briar Patch, Jacobin, and Tamil Guardian, among other places. Second, we will hear from Esther Ajiboye. Esther is a communications researcher and professional with extensive experience in newcomer serving nonprofits and academia. She is passionate about newcomers' access to information and equity, digital communications, and addressing misinformation. She's very interested in social impact initiatives embedded in communication practices, as evidenced by her immediate past role as a content specialist at Refugee 613, where she led the COVID-19 vaccine communication initiatives of the Newcomer Information Hub to address COVID-19 vaccine misinformation and improve information equity among newcomers. She is currently the program manager of the Vaccination, Misinformation, and Digital Media Project at Refugee 613, aimed at building capacity for evidence-based communication about vaccination. Very much looking forward to the discussion today, and let's get started with Brannavy.
Introduction, Emily. I'll just reintroduce myself a little bit. My name is Brannavy Jeyasundaram, and I'm the co-executive director of the Toronto Ward Museum and a writer, and a lot of my work over the years focuses on cultural memory, as Emily shared, and placemaking across diaspora communities. Specifically today, I will be discussing how oral history methodology embedded in the Toronto Ward Museum's work can affect public health outcomes, especially within migrant communities. So I'm going to go ahead and share my screen. And you can see this. Okay. So first, a bit about the Toronto Ward Museum. The Toronto Ward Museum is a museum without walls. We're dedicated to telling stories of migration to Toronto. We are fundamentally a community-engaged museum, so all of our programming and exhibitions are co-developed and co-delivered by program partners, community members, young teams, and professional artists. Our programs are delivered in neighborhoods throughout the city and online. And the museum takes its name from St. John's Ward, a historic neighborhood in Toronto that was a landing point for newcomers and is now commonly understood as Chinatown. Our flagship program, Block by Block, which I'll elaborate on further, has preserved and animated 130 oral histories in 4 Toronto neighborhoods over the past 4 years. And the neighborhoods we've been working within are Agincourt, Victoria Park, Regent Park, and Parkdale. So I'm hoping to first establish an understanding of how COVID-19 specifically has impacted migrant communities. And I think many of us are familiar with this map. It was released by Toronto Public Health in May 2020, and it very painfully and vividly illustrates the disparity between infection rates across various neighborhoods. And we learned then that in the most diverse neighborhoods in the northwest region of Toronto, the Scarborough area, COVID infection rates were 3 times higher than in the least diverse neighborhoods. And people residing in these neighborhoods were twice as likely to die from COVID. Of course, this is due to systemic racism and class-based oppression, which produces precarious conditions for housing and labor in migrant communities. And through the pandemic, increases people residing in these neighborhoods' proximity to death. And I wanted to parallel this with an insight from Yan Chen, an Agincourt storyteller from the 2020 Block by Block program, who articulates these issues within her community and advocates for change by pointing to them and having experienced them. So when we understand misinformation within migrant communities, I think it's important to understand misinformation as a symptom of a public health failure really to meaningfully communicate critical information and engage migrant communities. I think it's a little overly simplistic to understand misinformation as rampant in specific communities without understanding the conditions within which these communities are surviving. And through our several years of oral history research, we've learned kind of common truths within migrant communities. And one such that would affect a public health measure addressing misinformation is that local and ethnic community networks are integral to settlement processes and participation in civic responsibilities. Culturally specific communication is vital to engaging migrant communities, and barriers to accessing social support such as immigration status, precarious employment, and housing contribute to disengagement and mistrust of government. So I want to share a few narrative examples of how this has worked or leveraged successfully through our pandemic response, especially around getting vaccination rates higher within these neighborhoods, as well as been challenging and presented barriers in these communities. So speaking to the strength of community networks, I want to share the example of Sugandhini Sundarlingam, who was a vaccine ambassador for the Scarborough Center of Healthy Communities, and I was lucky enough to profile her for the local Toronto-based health magazine. And essentially, the Vaccine Ambassador Program enabled Sugandhini to personally connect with networks to share information about vaccination, with people who may have been vaccine hesitant or didn't have the support to attend a clinic, such as elders within our community. And this program was administered within the summer months of 2021, so May to June. So over a year after the pandemic struck or took form in Toronto. And Sugandhini really is a far more effective conduit, as she shares the same experiences as the people she's engaging with. She can more empathetically and effectively respond to their concerns. And another such example of using community networks to share public health information and improve vaccination rates was a pop-up clinic in the Brannavy region in Brampton, which was also disproportionately affected by COVID, specifically held with Black, African, and Caribbean communities who reside in that area and have specific health concerns and histories of engagement with public health systems. The next example I want to share is culturally specific communication. So also for the local, I was able to do a deep dive into the role of ethnic media in conveying information relating to COVID. And what I learned is that there is a significant effort amongst ethnic media producers, but also their readers, to access culturally specific information as it relates to migration, housing, and the intersections with the pandemic. And here on the left-hand side is an article published in Wellesley in March of 2020, so at the onset of the pandemic, on coronavirus and the safety measures that one could take to protect themselves. And on the right-hand side, you'll find a photo of a man exiting a grocery store and being able to access these newspapers as part of the ritual of going to a specific Tamil grocery store. So public health communications should tap into existing innovative methods migrant communities have invented for conveying information, such as the ethnic press, as it is a powerful and effective conduit for this information. And the last example I want to stress or expand upon is a barrier-free access to public health information and support. So I want to highlight this example of a low barrier vaccine clinic in Kensington, Chinatown in June of 2021, so around the second dose at the Cecil Community Center. So this clinic was a low barrier clinic in the sense that you didn't need to provide an OHIP or ID in order to access vaccine, and it was marketed as having interpretation services. But what grassroots organizers who are working within the community to link marginalized communities, especially undocumented people, to the clinic, found that it was very poorly organized, and there wasn't actually significant interpretation support or training really in how to communicate with the users of a low barrier clinic. But on the opposite side, you see a photo with lion dancers, and like on the exterior, what looks and appears as an inclusive clinic. So it's important to understand that these interventions and these specific methods of communication and engagement require time and resources to meaningfully address people who face additional barriers to accessing health services. So obviously this requires a political will and commitment. Grassroots efforts throughout the course of the pandemic and continuing today are extraordinary. However, they're not sufficient to address misinformation in migrant communities, and this requires significant public investment. Newcomers should be valued as experts and be able to define and lead public health engagement within their communities. Culturally specific resources and interpretation services are vital in ensuring equitable access to public health resources, and barrier-free services must meaningfully address systemic injustices affecting newcomers, such as immigration status, precarious housing, and challenges to employment. And I want to end with another note from Yan, who was an agent court storyteller for the Book by Book program. And in her oral history, which was collected in 2020, so at the beginning of the pandemic, said, my dad really still doesn't speak a lot of English, but he views Scarborough as his home because of the community he has. People who are being discriminated against and excluded are more compelled to find communities where they can feel validated by their own humanity. And I think that's a really powerful and resonant sentiment in that public health efforts addressing misinformation should attempt to do this. They should validate newcomers and migrant communities' knowledge, the specific challenges they encounter, and above all, their humanity in order to effectively and meaningfully engage them. And that's the end of what I've prepared. The Ward Museum's work is on our website, www.wardmuseum.ca, as well as on social media at Toronto Ward Museum. And this year, 2022, is especially significant because it's the culminating year of the Block by Block program, and we have a lot of exciting programming prepared in our individual neighborhoods, as well as a citywide exhibit in Toronto. So do follow us to keep up to date with that. Thank you.
Thank you very much, Brannavy. We appreciate the knowledge that you have shared with us and looking forward to the discussion. So I'd like to turn the spotlight to Esther now, and Esther will talk about her work with Refugee 613. Thank you.
Thank you very much, Emily. And thanks for that powerful presentation, Brannavy. Hello, everyone. I'll begin sharing my screen now. Perfect. So I'm speaking with you all today from Ottawa. And I'd like to begin by acknowledging that the land on which Refugee 613 is based is the traditional unceded territory of the Algonquin Anishinaabe people. The Algonquin peoples have lived on this land since time immemorial, and we're grateful to have the opportunity to be present in this territory. I'm a program manager with Refugee 613, as Emily mentioned in my introduction, and I'll just begin by explaining what Refugee 613 is. So we are a communications hub that informs, connects, and inspires people to welcome refugees, newcomers, immigrants, and build strong communities. And we do that by convening stakeholders to collaborate on improved information flow. We also lead collaborative research and strategy development to improve communications dimensions of settlement and integration. And this spans various realms of integrations: information access, refugee sponsor recruitment, and equity issues generally that apply to newcomers and immigrants. We
Esther?
also create.
Sorry to break in. We can see your speaking notes. We can't see your slides.
Oh, I'm so sorry.
It's okay.
Would you like to share my slides for me?
Nina, would you be able to share her slides? Okay, we can see your slides now. Thank you.
Okay. Just a second. You see my slides now?
Yes, thank you.
Thank you. We offer strategic communications consulting. We also try to learn, to share the things that we've learned with other people working with newcomers and racialized communities. And this because we believe that the more informed and connected everyone is about services generally, ranging from health, policies, all kinds of topics that have to do with settlement and integration, the stronger our welcome and our communities would be. And this leads us to asking questions like, who is getting what? Who is not getting what? Is this information tailored to meet the needs of the audience? What can we do to make sure that information gaps are closed in communities? And with that as a background, I'll move to COVID-19 communications and what we have done to respond to the information gaps we saw. As many of us know already, low-income, immigrants, racialized communities were disproportionately impacted by COVID-19 in terms of infections, hospitalizations, death, job losses, or even lost income. And many reasons accounted for this. There were more, because many of them were working on the front lines. They were more exposed. They were more exposed to COVID-19. They had increased risks. They had reduced, of course, existing socioeconomic barriers to health were also there, reduced access to medical care. And the one that we focused on as a major barrier was the high volume of misinformation that was targeting immigrant communities. And so for those working at the community level, organizations like ours, we knew that the disproportionate impact of COVID-19 was predictable. And so in 2020, of course, when the pandemic started, our team quickly realized that the level of information and communications for immigrants and racialized communities was not nearly where it needed to be. For instance, key information about how to protect yourself, why you should protect yourself, how the virus is transmitted, where to get tested, why to get tested, why the vaccines were not rushed, all of those information. They were not, all of that information, I beg your pardon, they were not available widely in plain language or even in culturally relevant translations. And even when they were usually buried somewhere on websites that the intended audience would never visit. So what the pandemic revealed to us is that the strategies for communicating about broad health and general service topics did not really see immigrants and racialized communities as distinct audiences in their own rights. They didn't segment newcomers as, when I say newcomers in this context, I'm referring to immigrants, no matter how long they've been here, racialized communities, everyone that arrived in the past 10 years or thereabouts to Canada, and whoever is still in their settlement and integration journey. And what many communicators did not realize at the beginning of the pandemic is that this class of audience has their own unique information habits. They have their own preferences. They have their own information needs that sometimes differ from those of what we would call the general public. And sometimes it's not even just that, it's the language, it's the tone, sometimes it's the format, sometimes it's the distribution channels, and sometimes it's all of these that accounts for how information is accessed, processed, and taken by newcomer audiences. I know that this might be a generalization because they were, just like Refugee 613 rose to the challenge, there were some communicators that were very much aware of newcomer needs. But a lot of communicators, as Brannavy hinted during our presentation, were working hard to produce lively, engaging content in English and French in general social media like Twitter and Facebook. And it's also understandable because we were not prepared for a pandemic. Nobody knew it was coming. The general audience, the general populace was also trying to understand the virus, to understand how to stay safe, how to adjust to the new normal that we've been living through for about 2 years now. Yes, that was understandable, but our position was there are some people who are even in the most precarious situation. Are you catering for them in this scramble to help everyone understand what's going on around them? And as the pandemic went on, some institutional communicators began to develop multilingual fact sheets to post on their websites, which was a solution, but it wasn't the best at the time, and even up till now, because they were on channels where the target audience that this content was created for were not very active. Most newcomers, from our research and our engagement with community, they don't visit those institutionalized websites. They would rather get the information through other sources. And I would explain as I continue. So they were getting their information as the pandemic started and evolved. Many newcomer audiences were getting a steady flow of informal information from their friends, from their community leaders, and they were also relying heavily on diaspora channels, on WhatsApp, for instance, on WeChat, on Telegram, and other platforms that were easily accessible to them, platforms that they were already very familiar with, where they have most of their communications take place, the platforms where they connect with members of their community and those that matter to them. And while this pattern of sourcing information is important, it's good, it's vital, it could also be double-sided. It could be dangerous because first of all, it fills the gaps that official sources have left. That's obvious. It's giving them an information need. And
Esther, I'm sorry to break in again, but your slides are not advancing.
Yes, I'm still on the main.
Oh, perfect. Okay, thank you.
Thank you. I tried to make my slides not too many. So it's important, but it's also damaging because it allows for a deluge of inaccurate, unvalidated information. Accurate information was coming in, but it was small compared to the amount of misinformation that these audiences were received. And we're already, as I established already, official communication from government and health authorities, and even those from newcomer serving organizations, they were not getting through to those communities, or they eventually get through to those communities long after misinformation has reached them, long after they have internalized the messages, the propaganda from misinformation and disinformation champions. And what we emphasized is that the communicator's golden rule is always to know your audience and meet them where they are. And for a long time, since the pandemic started, this rule was not applied enough to communication with newcomers and racialized communities. And by treating all audiences as the same, communicators collectively fail to recognize that newcomer and racialized audiences have distinct needs. And what we have done, we now collectively, referring to all communicators who did not rise up to the challenge in good time enough, is that we have fostered information inequity. We have fostered an inequitable information flow. And so Refugee 613 needed more effective ways to reach newcomers with essential health information. And so we started the Newcomer Information Hub, which I'm going to focus a little bit on today, thanks to investment from the Immigration, Refugee and Citizenship Canada, IRCC. We created the Newcomer Infohub to do one main thing, to test ways to make more trusted, multilingual, culturally appropriate COVID-19 information would get to newcomers, and to explore how to make it more accessible to newcomers on the platforms and the spaces that they use. So what exactly is the InfoHub? Since we started in 2020, it has evolved as we responded to change, as we worked together with community and partners. It has evolved in formats, but right now it has three primary elements. The first is the content team that is constantly developing specific content in different languages and formats, say videos, fact sheets, infographics, and so on, to meet COVID-19 information gaps. We worked with partners in health and settlement to create, for instance, the vaccine bulletin series, one of which I'm showing on the screen right now, which was designed to ensure that newcomer connectors and service providers can use it as a script to record videos or audios for newcomers. And also it was produced in a format that could be easily shared across instant messaging platforms like WhatsApp and Telegram that I mentioned previously. So we had a longer bulletin and a shorter version. The longer one could be used as a script, and the shorter one was just shared across various social media platforms. We also had videos that we posted on our YouTube channels and also shared among community members, especially at a time where people even had basic questions about benefits, especially as people were losing income or they couldn't go to work. And something we noticed, which many of us also are aware of, is at the beginning of the pandemic, many were afraid to get tested because they were worried about the lost income if they got a positive test and were told to stay indoors. And this just escalated situations in terms of COVID-19 infections. And who were these people most affected? They were low-income immigrants. So as part of the content team, our team is mostly made up of immigrants, including former refugees, and everything that we do is built on working with and learning from newcomers, diaspora communities, frontline service providers, the government, and other sectors. Another aspect of the Newcomer Infohub is the Multilingual Infobank, which is an easily searchable database of resources, fact sheets, articles, videos, infographics, websites in multiple languages from trusted, verifiable Canadian and international sources. Although right now it's primarily focused on COVID-19 information, if the funding for our project is renewed, we're planning to expand the focus of the Infobank. And what this Infobank was mainly for, and it's still active, it's available on our website, which I'll share at the end of my presentation, is that it allows for those who we identify as newcomer connectors, community leaders, service providers, to easily find resources that would meet the needs of their audiences, the audiences that they serve. And then the third aspect of this project, which is what we are focusing on now that we are 2 years into the pandemic, is knowledge mobilization, which involves consultations, providing strategic advice to communicators, especially government communicators, in webinars, in trainings and conferences, to share what we've learned about how to strategically communicate for newcomers, and also to hear from others who are working in the field. So far, we have been building sector and community capacity to provide accessible pandemic information to newcomers. We also have been collaborating with community to create and also curate trusted COVID and vaccine information. And we've been fostering system level change by advising institutional communicators on how to meet the information needs of newcomers based on our research, based on our experience, and based on all that we have heard from stakeholder tables, both within the community and within the sector. And some other things we've been doing is to test new content to help communicators improve their ability to serve newcomer audiences, because in as part of our work in info equity, we do some advocacy, and we've been able to get the ears of government communicators to share their content strategies with us. And what we do, if they have an idea or they're producing a content, we help them take this to newcomer audiences to test, to get feedback before they roll it out, to be sure that it sits well with them, it aligns with them culturally, and it also provides them with the information that they need. I would focus today on how we were able to create multilingual, culturally accessible COVID-19 resources for newcomers, including infographics, short videos, and of course, a vaccine bulletin series, which was produced in 16 languages and which has over 15,000 downloads and has reached an estimate of 75 to 150,000 people. So what did we do? How did we go about this? The first thing we did was to prioritize listening to the audience information needs and meeting them. We realized that when a lot of advocacy voices were championing the need to provide information for newcomers in culturally accessible way or linguistically accessible way, communicators just went all out and started translating everything they had without checking to be sure that that was actually what was needed at the time. And so we know that we've gone through lots of phases with COVID-19 and the information needs have changed over time. Our focus with the vaccine bulletin series, for instance, was to go through our stakeholder tables across various newcomer serving sectors and also tap into our local networks, our local newcomer networks that we have direct access to by virtue of our work and by virtue of the fact that our team is made up of immigrants and former refugees. And we were able to identify and also anticipate, because based on the questions we heard, we're also able to anticipate their information needs. And what we did was to mobilize with partners to fill these gaps. So if it's sensitive information about, say, vaccines and composition and all of that, we started the content development with our partners. They gave us all of the professional, evidence-based insights and inputs, and then we ensured that our information was simplified enough in plain language to make it easier for everyone, literates, mid-literates, or whatever level of information consumption expertise they have, they are able to access that information. And then, as I suggested before, we engage a lot in audience testing, whether for even some of our content or even those from other communicators, to give newcomers the chance to co-own the content production process and also to offer us useful feedback and insights on content and formats. Something else that we leveraged was cross-sectoral collaborations with newcomer serving organizations, both in settlement and in health, and as well as newcomer communities themselves. So together with all of these collaborations, we're able to pull together our respective areas of expertise to do the research, to write, to translate, to design, and also to produce those bulletins that I mentioned earlier. When I look back now, I would say that although some of the activities of our InfoHub work have evolved since its earlier days, it has always been collaborative by design, both with newcomer connectors and also with newcomers themselves. And the last thing I would share is, and I liked that Brannavy mentioned it, which is a pointer to the fact that this idea is spreading now, and we're hopeful that going forward, as we have experienced all of the ups and downs of the pandemic, we would do better in communicating, in addressing information challenges, which birth misinformation, which can birth chaos, because we all are aware that misinformation thrives in spaces, and these spaces become echo chambers, and then the misinformation becomes something that is hard to control. So why not address it from the get-go? So by valuing newcomers' cultural expertise, we engage in various things, like the first one I said, research and testing with the audience. The other thing is even to involve them in the translation processes. So we know that lots of efforts are being made right now to ensure that machine translations are accurate as much as they can be. But we also know that at this point, we are not yet at the stage where we can fully rely on these translations. The translations many times do not fully capture the cultural and contextual cues or meanings that are embedded. So we invested heavily in professional translations, of course, thanks to our funders, IRCC, but we did not stop at that. We took the translations to the community for what we call community review. And we always consider this a non-negotiable process in the content creation. And what does that entail? Very easy, but also very invaluable. We ask native speaker community members to verify that the translations are not only accurate, but they are also easy to understand by an everyday user of the language. We also ask them to check if it's culturally accessible, if it needs to be refined. And before publishing, we share the designed versions again with them to confirm to us that no errors were introduced into the design. In our focus groups, in some of our research and interactions with newcomers, we've heard them complain about certain translations of relevant information. And then when you tell them that, oh, the government has provided this information on their website, they say, the translations are not readable. We don't even understand them. They don't care. They just put something out to say they are doing something. And that's what we try to avoid with this community review stage, which could actually be intensive because it's a lot of back and forth. But we go through these stages to make sure that our resources would remain trusted in target communities. And we needed to put the work in because we know that trust that is lost with audience is sometimes difficult to regain. And so our vision and mission as an organization generally speaks of people and communities, and we take seriously any feedback we get on translations. We also provide them with a modest honorarium in recognition of their expertise and the time that they've spent when they participate in our focus group sessions. We also compensate them for this. And I'll end by saying that the truth is that as communicators, we need our audiences as much as they need us. So because of this, we should always approach content creation as a consultative and not a prescriptive process, because people would listen when they feel heard, when they see themselves in messaging, when they're included in the creation process in a respectable way. And when it comes from people or sources that they trust and are familiar with. And it's co-creation that would make this happen. It's working together that will make this happen. If everyone starts to think more strategically in this area, we believe that we can reduce the information gaps and also reduce the spread and flow of misinformation. As part of working together, I would encourage you to share your resources with us in the Multilingual Infobank, which is available on our website. You could also send your ideas, you could send your feedback, and together with the prof who is not here today, Professor Nadia Kaidi, we just started another project that is focused on building the evidence to show how misinformation actually flows in these newcomer digital spaces that I've been alluding to. We've been saying it, but it's time for us to, especially in the Canadian context, it's time for us to look to see the strategies that are being implemented so that we can work together with governments and service providers to reshape our strategies to align to land easily with newcomer audiences. The project is going on up until 2023, and Professor Nadia Kaidi and her team are working with us on the research aspect for us to have more concrete evidence to show to the government and to stakeholders how to better address misinformation. So whatever we find from that study, we would engage in a lot of capacity building and knowledge mobilization activities, not just for the government and their communicators, but even for newcomers themselves, to be able to lead and maintain critical conversations about misinformation, about general health vaccination information, and so on. Thank you so much for listening today.
Thank you so much, Esther. That was a fascinating presentation. I don't think we saw any of the materials that you were mentioning, but we will make the slides available after the workshop. And if you have anything else that you would like to discuss or present about them, that would be great. Again, thank you both for very, very interesting presentations. I'm noting a lot of themes across both presentations and also what we discussed at our last panel event last month. And we'll dig into those during the discussion. The questions are starting to come in. Please, everyone participating, please feel free to submit your questions and I will pass them along to the speakers. The first one, Esther, I think that you touched on it a bit, and Brannavy, I'm not sure what opinions you might have about it, but the question is, for people who do not use newcomer services, but need access to reliable information, what is the role of other agencies such as healthcare providers, community leaders, and so forth in helping to combat misinformation and disinformation? So I guess, Esther, I'll pass it to you first, and then Brannavy, if you have any thoughts.
Thank you. That's a very interesting question, and it's the same message that we've been championing in relation to that. Not everyone would use these services, and so what we need to do, and everyone who wants to get across important information to these audiences, is to work with the voices that they listen to. We are, as humans, we do not exist in isolation. We have those we connect with. So if it's faith leaders, connect with the faith leaders. And if they would rather develop the resources themselves, equip them. If they want someone to develop the resources for them, provide them with the resources. If they would like, and that's me saying that every audience is different. So if they might want to be, if they might say, okay, come to let's use the church or the temple or the mosque, come there and speak. If you're speaking from this podium, from this platform, they would listen to you better, do that. But there is always a bridge. That's the point I'm trying to make. There is always a way to reach them. If it means connecting with those in the grocery stores, local, the grocery stores that these audiences use, connect with them. If it's their faith leaders they listen to, connect with them. There is always that one person or that one group that can help to be the conduits for these messages.
Thank you, Brannavy. I see you nodding.
Yeah, I thought that was so well put. I think it's an interesting question because not everyone, especially if you're not a recent immigrant or newcomer, are engaging with migration and settlement organizations, yet misinformation is still like widely spread within specific channels. I agree with Esther in that there needs to be a multi-pronged approach to sharing meaningful information and engaging newcomers and being able to lead and define that information. So in the example of Sugandhini, she's a vaccine ambassador who has been equipped with credited information and can have meaningful one-to-one conversations. And while that's a far more personal approach and perhaps not as vast in its reach, having vaccine ambassadors who can invest that time and who have personal connections to community members, regardless of their immigration history or how long they've been in their neighborhoods, is very important. As long as in addition to mass accessible, culturally specific media campaigns. So I think fundamentally we need a variety of streams of information.
I completely agree, and I'm very, very much interested in hearing when you mentioned about vaccine ambassadors. This is a model that I have seen used in a number of contexts. I know that there is a scholar, Sarah Torres, who has been writing a lot about cultural brokerage and having the specific community leaders within different groups, getting information, even training to share reliable, accurate information with their communities in sensitive and appropriate ways. So I think this is and this is also something that we heard about at the last panel discussion with Nira Elgueta talking about the peer champion programs that OCASI has been working with. Okay, thank you. Next question. Do you think that apps like WhatsApp and Facebook, WeChat and Twitter have a responsibility to combat misinformation on their channels?
Well, I could start. We know, let's use Facebook, for instance. We know the issues that the organization has had in addressing this. So I might not necessarily say that the onus is on them, because people who promote disinformation or even misinformation, disinformation because of the intent, they are usually very ingenious and they try to bypass systems. I would not say the onus completely lies on these organizations. They can in their own way, but we also need to be conscious of the issue of trust and privacy. Platforms like WhatsApp and Telegram, for instance, are encrypted spaces. And it's difficult for them to go into those spaces to filter things. I'm aware that a platform like WhatsApp, for instance, has started, which is an indirect way for them to rise to the issue of misinformation. I know they've been working on research with a lot of professors on this. Something that I know that they've started very recently, maybe some months ago, is to show that a message has been forwarded over and over again. So they've started restricting the forwarding of over forwarded messages to, let me say, 5 audiences per time. It's their way to control. And I think it's the important thing here is information literacy. Information literacy should be the focus of, it should be part of policy development. It should be, for instance, when newcomers have arrived, do they have, as part of their orientation program, do they have core sessions on information literacy? How do you critically examine a piece of information when it comes to you? For me, for instance, if I receive a message that has been forwarded many times and WhatsApp flags it to me, I do my own research to be sure that this is not misinformation, because we know misinformation is it just goes all out there. So it's a two-way thing. Private corporations can do some, but they cannot do it all. There is a limit to how they do it, because take it or leave it, we live in a democratized world, and there is a limit to how much control they can have. But how competent is the audience? How strengthened is their capacity to filter bad and good information? I think that's where we should focus our energies on. Thank you.
Thank you. Brannavy, anything to add? Yeah, that was so, again, well said, Esther. It's really challenging because Facebook, which is also WhatsApp and Instagram, is it's a contentious issue, and I almost think of them as their own like technocratic government in some ways. And of course, these algorithms are designed to expand the time in which we spend on these apps, and doesn't necessarily prioritize well-being or information literacy. And of course, we saw through the pandemic iterations of COVID information being spotlighted around posts that in any sense linked to COVID. And that technology is through, I obviously don't understand the full complexity of it, but it's an AI system that is able to register and read information and identify when COVID is mentioned. And that brings into question issues around privacy and confidentiality. So I think fundamentally we need to equip users with, as Esther said, information literacy, as well as, this is a larger issue, but an attitude and behavioral shift around how we engage with these apps.
That's a fascinating point, and I don't know how we would achieve that, but it's definitely something to work toward. Okay, thank you. Those fascinating points. Next question that has come in. How do we decide on what constitutes misinformation versus simply a difference of opinion on issues? I have some thoughts on that as well, but Esther, or if you'd like to start.
Yes, that's a very good way to put it. And before answering the question, I would say this is something that we should be mindful of when we're engaging with people, especially when the position they have brought is false. And when someone brings false information, we like to say it's misinformation because they don't know. They really think it's credible. It's been framed as real. But when someone knows, or when there are two ways to disinformation, someone could see something and know that it's wrong and still want to propagate it. Or someone could actually sit down and cook up stories and merge videos to propagate it. That is disinformation. That is with an intent to mislead people. But misinformation, usually it's from a place of, I care about you, I'm sharing this information with you. And so that person has accepted it as true. Whoever is engaging them needs to respectfully acknowledge their concerns, because we all have our fears and we all want to protect ourselves. So let them know why that information is not true. lead them to how to fact check, show them credible resources, and also address their main concerns, because it's not the information that is the problem, it's the concerns underlying it. Concerns about trust, for instance. If someone shares something and says, when the vaccine was administered here, this was the side effects. Show them empirical evidence. Where possible, if you have people who look like them, who have credible evidence to show that that information is false, let them see it. So validate the information, validate the true information, and address their concerns from a place of empathy and understanding, knowing that this person did not have an intent to just amplify false information. They just don't know. And for someone who is bent on passing across misinformation, it's the same process, it's just longer, because this person has gone deeper into that phase of, I just don't want this to work. So it's also coming from a place of fear, historical issues of mistrust. At this point, they had victimized us, or they had used this and done this against our group. Maybe someone is bringing a perspective of ethnic cleansing or something. Let them know how times have changed, and also bring the pros. For instance, I'm going to use vaccines. We all know that vaccines have saved lives. Many years, like we've survived various pandemics because of vaccines. You can show examples. And I saw a post from someone, I don't remember who, but it originated here in Canada, but it's been amplified, of those who had vaccine scars, how that's like a mark to show that this is not the first time this is happening. It's been tested and other things. I would keep quiet now so that Brannavy has a chance, but you just meet people where they are and take them to a higher level of understanding.
I don't have much to add. I think that's such an interesting question and something I consistently think about as well in my writing. It actually, more anecdotally, in preparation for this panel, I was looking through my WhatsApp messages and like specific Tamil group chats with like multi-generational audiences or members, and I came across an infographic at the onset of the pandemic that linked the virus to a specific pH level, and then recommended diets that you could adapt in order to reduce your risk of attracting the virus. And there's these narratives and these like quick fixes or these ideas that we can remedy these conditions, and they're born out of just being in a very challenging situation and not having a full grasp of what's happening. So I'm empathetic to them, but I think it becomes misinformation, and this goes back to the ecosystems within which these messages are being shared, which are, WhatsApp and Facebook, which are designed to kind of be viral and expand to, various audiences. It becomes misinformation when it states a truth, sorry, not a truth, but it states an opinion or an assertion as fact, when there's a clear record of it not being aligned or true. And this is honestly very, I would say, subjective. So yeah, it's a tricky situation.
So what I'm hearing here is several things that I'd like to tease out a bit. First of all, Esther's point about how so much of the hunger for information about COVID is based around fear. People are very fearful of this virus with very good reason. And bringing in correct information to them, evidence-based information, in compassionate and patient ways could be probably one of the most reliable ways to stop the spread of misinformation one person at a time. And when you can convince one person, you don't know how many people that person is going to talk to, but we've been hearing a lot about the interconnectedness of people in communities. and getting just one perspective out there that is more based in what the evidence is saying, what public health is saying, what the science table is saying, and getting that out there in compassionate, empathetic ways, I think can be very powerful. Okay, let's move on to the next question. Not all newcomers read ethno-specific media, and they don't often have large budgets to, like the ethno-specific media often doesn't have large budgets to circulate information. Do you think that more mainstream or news organizations should be doing more to incorporate newcomer populations and be more inclusive, to share information in more culturally sensitive ways? And Brannavy, I'll give this one to you first.
Sure, and that's completely accurate. A lot of ethnic media operations exist on a shoestring budget, and they don't have a lot of resources to pour into their work, which makes it all the more remarkable. I think larger media corporations who have a lot more access and resources to pour into their information and their channels should invest in journalists and in understanding communities that perhaps are more diverse and have strong populations of migrants and newcomers. In order to better understand them. It's just, it needs to be done with care, because what oftentimes happens, and this is part of the motivation behind the block by block program, is journalists will write very kind of one note or stereotypical ideas about a specific neighborhood that then becomes how people cast areas like Regent Park or Parkdale, and then that's how they're attributed and understood and then further isolated. So I do believe that, there should be culturally sensitive reporting, but that requires a lot of care and nuance, and fundamentally a shift within the media and broadcasting industry. But alternatively, there are very good sources of information. I mentioned The Local a lot. It's a magazine that strives to do this. So the work is being done, which is nice.
That's great. Thank you. Thank you. And I think some news organizations have been doing some to bring in more racialized journalists, people from communities. Efforts of organizations, media such as The Local, have been really critical, but The Local is small and it's not very mainstream. Like, you're not going to find a lot of people in communities who are reading it. Esther, did you have anything to add?
I think Brannavy has said it all.
Okay. Okay, so to build on that, we've gotten another question which touches on some of what Brannavy was just talking about. A recent survey of Canadian newsrooms found that 75% of the journalists were white, which is not at all representative of the Canadian population. Is this part of the problem in reaching newcomer populations? I would suggest that yes, it is. And if so, how can we get more diversity into newsrooms? Brannavy, since you've worked as a journalist, I think this is quite relevant.
Yeah, I'll go ahead. I'm familiar with that statistic, and I am not surprised by it. I am hesitant to assume that shifting demographics while maintaining power will help support journalism that complexly and meaningfully examines how migrant communities experience their world, or especially access healthcare. So I think there needs to be a shift within how these organizations themselves, they're oftentimes very hierarchical. We know this isn't only Canada, but in the US as well, they're conglomerates. So So media can become very concentrated in how information is released, which is why as a reader, I would encourage, and I try to do this myself, is seek alternative sources of information. I do think having racialized reporters will help bring stories that are lesser known to the forefront, but I don't think that's necessarily a solution really in being able to meaningfully address migrant communities.
Okay, thank you. Thank you, Esther. Anything to add?
Yes, just as Brannavy said, it's part of the solution, but I think what could be helpful, which I know that formal media is beginning to do now, is to also diversify their channels of information dissemination. So they could, whatever strategy they're going to use, but they could connect with those spaces. And even if it's them starting by running informational campaigns as ads in the platforms that these people use, it's one way to let them know that, oh, okay, this organization exists. Put something out there in, say, their language, or have a representation there in those spaces they use. And that way you begin to win them over. It takes time. Like the study that I made reference to about how many newcomers consume information from other sources outside of formal news is actually a study by CBC, part of their MTM study. I know they're planning another one this year, but that's the results from last year. And it was very apparent that many newcomers would not consume news information, and every other official information from official sources based on that study. And if that's the results, winning them in by bringing representation might not be the full way, but letting them know you exist, because many newcomers are already attached to the previous media, previous international media, and even local media that they're connected with, and they just keep watching those. I'm a newcomer myself, and I cannot list 10 or 15 credible news outlets in Canada. I'm familiar with, say, 3 or 4 that I listen to, and that's because I'm intentional about listening to news. So for someone who is not even super intentional, they don't even know, but by the time you put yourself where they are and you show them that your stories align with them, you invite them to share their stories, their experiences, the news begins to spread. So someone in Community X, for instance, is invited to this platform, to a news platform, to say something about their experience. They provide them with a promotional resource that they can share with your community members. And then everybody likes to see their folks on TV and all of that. So you're winning them, and gradually people's interest will be shifting. So many ways to do it, just to make sure that information is discoverable. Representation is one. Amplify the voices, go where they are, show them what you're doing in ways that show them that they can see themselves there. And more people will be more aligned to these spaces.
That's a great point. Thank you. You've stressed throughout the importance of meeting people where they are. And what I'm hearing here is that targeted outreach, very thoughtful, sustained outreach to communities through channels that they are much more likely to interact with, is going to be more successful than just bringing in the stories to the mainstream news. Yeah. Okay, thank you. Some great points there. The next question. It's about 80% of newcomers who do not access official settlement services. In your work, do you have any insights as to why? Do they do their own research? Are they not available? Are they not aware of the services that are available? And any insights on the percentage of people who get their information through other sources? For example, community leaders, Google, private sponsors, if they're refugees and have come in through the PSR program. Yeah, why don't they connect with settlement services, and where do they get their information instead?
I'll just chip in what I know. We don't have actual statistics now, but we have insights. But I'm also aware that the Association for Canadian Studies is doing a particular study right now. And one of that is to find out why people prefer certain sources to others. But I'll just start with the first thing of trust. And ironically, we did a very small study, audience research testing, about one of our, not our resource, one of the government health resources, and we shared it with a niche group, an Arabic speaking group of people in Ottawa. Surprisingly, the findings from that study showed us that they trusted anything that has to do with the government. These people were former Syrian refugees. Maybe that would give better context. Any material that has the government of Canada on it, they trusted it. That worked for them. But I'll go back to my point at the beginning that these audiences are heterogeneous. What works for community A would not work for community B. And so if they are not accessing those resources, they have their own specific reasons. Most of them dwell on two things: trust. I trust the government, I don't trust the government. It's two ways. So how do we foster that trust? It's still working together. Statistics wise, we don't know how many, but what I would recommend is if a particular, because newcomers are varied. Everyone comes with various experiences. There are people fleeing from war. There are people fleeing from just economic troubles. There are people fleeing from all kinds of situations, and they have found themselves here. So the history of their arrival plays a role in how they interact with information they receive. And if we want to reach them, we need to have that context so that we connect with them. And it still goes back to having various methods. There is no one size fits all. If they connect with private sponsors, if they connect with community leaders, connect with those people. Thank you.
I'll just add a little bit to what Esther said. So this is mostly grounded in our oral history research, so I don't have specific facts or figures, but what we've learned is that a lot of migrant communities are very dependent and interdependent in a special way within their own kind of local networks, and oftentimes that's through their ethnic communities. And that has been proven instrumental in their own settlement process. And there's hesitation in accessing settlement organizations that perhaps are funded by the government or affiliated with the government because of their own fear of reprisal around their migration status, around their precarious employment, and even their housing or living situation. So I think migration and settlement organizations, and some of them do quite a wonderful job at this, need to promote the fact that they're barrier-free or lower barrier in order to build the trust and safety that who's ever accessing them will understand that their concerns are being met as an individual and as a person, rather than as someone who is in contradiction with specific legal requirements or whatever that may be, because the migration process is incredibly challenging for so many people.
It very much is. And one question that I wanted to ask was about what you see as the role of pre-arrival services. The Canadian government is really shifting a lot of emphasis to sharing information with newcomers before they ever come to Canada. And what role do you see for promoting information literacy in pre-arrival services, if any? I'll give you both a moment to think.
I could start. I think they play a very important role. And as I said when I was making my presentation, weaving information literacy into services for newcomers is top priority, topmost priority. So letting people know before they come what the information scene is like and how to navigate it is very important. because we find that many times when newcomers arrive, and I think this also could connect to the previous question that we tried to address, when newcomers arrive, they are sometimes inundated with lots of information, and beginning to navigate through all of that could be wearisome for someone who is trying to just settle, trying to get used to, I mean, culture shock and all of that is going on, family and all of that. So weaving that is super important, but the government needs to be strategic about it. Maybe the services that are offered are well staged, because before, I'm speaking now again as a newcomer who arrived just at the beginning of the pandemic, I had access to pre-arrival services, but I did not fully engage them because I was at a point where I was planning to move to another country and I needed to block off hours of my time to certain meetings and all of that. It wasn't super practical for me. And I imagine that some other newcomers are in that situation. So provide them with, I like to use the term snackable resources that they can use. So housing, this is all you need. Once you arrive, contact these people. Shelter, this is what you need, and all of that. It makes it more attractive to the audiences. Something that we did at Refugee 613 for the Syrians, we actually started a WhatsApp group that moved to Telegram. And it was open to those, because it was for refugees, those arriving during the Syrian crisis. It was open to people already in the process over there in Syria. So they were able to have real live interactions with somebody about their questions. There were dedicated moderators on that group. And it was very helpful. We have people who are now citizens, Canadian citizens, who came in and had their integration journey explained to them through that platform. It wasn't a service, we're not having clients management or case management issues, but it was just for referrals, for easy connections. This is what you want. And it was also in the language they spoke, Arabic. We have now started another one, which has a national outlook for Afghan arrivals, dedicated spaces where someone has someone talking with them. It's labor intensive, but it just needs having people dedicated to it. So they have shifts and all of that. This is when this group opens. This resource is useful for you. If you have problems filing your tax, cultural, where to find cultural food. I mean, they are major issues for newcomers. How can I find halal food? It's difficult for me in this place. I don't know. So those kinds of options are available. And I believe that governments and settlement service providers can harness those ones to ensure that that way people are building community as they arrive. They are able to interact and they're able to communicate with people in the languages they are most comfortable with. Because the pre-arrival services could be inundating.
I think that's true. From what I've heard about the pre-arrival, it's I have experience as a link teacher, and I think back to my students just being so overwhelmed by the volume of information that was coming at them. And one of the last skills to come in acquiring a new language is being able to detect bias. So if they're getting information in English, they may not be able to detect the context clues in the vocabulary and the tone that would indicate that the source may not be reliable. Yeah. So what you said about the services being available in appropriate languages is so crucial. And it again is something that taxes the resources of organizations that are trying to provide these services. Okay, we have one last question. After the question, I'll remind everyone, please, to wait until the event has finished so that you will see the survey in your web browser. We will very much value your feedback and appreciate your time in completing it. The last question we have for today is, what can we as regular people do to be more mindful of the information we are hearing and sharing? What kind of questions can we ask ourselves before we share information?
I'm happy to start. Brannavy, would you like to start? Yeah, I would start with that word you used, bias. Let's always approach every piece of information with a biased mindset. And that's, don't fully trust whatever you have seen without checking to be sure it's true. So everyone needs to know how to fact check. Is this useful? Is this true? Where is the source? The source mentioned. There are lots of fact checking websites out there, easily accessible. Every time I'm in a group and someone sends me something about something happening in one country, it doesn't cost me 2 seconds to put it out in Google and see that, oh, it's been debunked, it's false. So our first responsibility before sharing anything is to check who is the source. What's the intent of this? Is this true? Am I sure this information has a potential of causing harm to the person receiving it? So have that biased mindset and always verify. I think that's my 2 cents.
Again, so well put, Esther. I think the only thing I would add to that is, and this is in the context of health information, is, we share a variety of information for several reasons. Sometimes I share memes I think are funny and will help my friends laugh. But when over the pandemic, sharing crucial health information, I think I fundamentally asked, is this credible? Do I know that this vaccine clinic, for example, exists and is servicing people? Does this help? Why is this important, critical? Why is this information critical to know? And just having that internal dialogue helps or prevents me from the impulse to share something and to have, I don't know, my voice also included in the conglomerate of information already accessible. I think when it concerns health information, we should fundamentally ask who it's serving and why it's important.
I agree that those are crucial questions. Who produced this information and why? And what are they trying to accomplish by sharing it? Yeah, what is their goal in sharing that information? And Esther, as you mentioned, very often it is a goal of kindness and compassion and protection. They want, so many people who are sharing this information want to protect their friends and family, and they buy into what some of the less reliable information. So by thinking, one helpful suggestion that I have heard, because emotions can run very high around these things, is to take a bit of time and pause and don't just react. Take the time to respond in a thoughtful and evidence-based way. Go look it up, find the reliable sources, do some thinking about what you consider reliable and how you can present your opinion about the reliability of the source in a respectful way. Okay, I would like to wind it up here, and I would like to thank you both so much for your fascinating insights. This has been a great discussion, and I really value and appreciate your joining us today. And to everyone who has joined us virtually, thank you very much for coming. Just briefly, I'd like to tell you about a new initiative of the Community Knowledge Program. We are currently putting together a research literacy course for frontline workers. It will be online. We will be piloting it in the next couple of months, and it will be publicly available by the summer. If you would like any further information about the course or to see recordings of this panel discussion and the previous one, those will be available on our website at wellesleyinstitute.com/community-knowledge-program. And you will receive that link in your email as well. Again, I would like to thank everyone for coming today, and I would also let you know that the link to the program will be shared in the chat. Thank you again so much for joining us, and this concludes our panel discussion for today. Thank you very much.